You must avoid these medications if you are planning to get pregnant as a woman, or if you are pregnant as a woman, or if you're that kind of person that have been struggling to get pregnant and you're not getting pregnant despite all your trials. You need to pay close attention to this video, because most of these medications I'm going to be explaining to you today might even be the reason why you're not getting pregnant. And it might even be the reason why you're experiencing miscarriage as a woman, and that's why you must avoid these medications. Now, why I'm going to explain about this medication is because most of you might have been using this medication, and most health personnel might not explain these medications to you. They might not explain the side effects to you because they feel you should know it, and you might not know. You might be innocent and you might not even know that these medications are what is causing your delay in getting pregnant, or it's what is causing your miscarriage, or it's what is causing problem to your baby after delivering your baby. That's why you must pay close attention to these medications, because these are the major medications that people keep taking every now and then. Now, one of the major medications I'm going to be explaining to you in this video, I have other medications here, but the first one I'm going to start with is tetracycline. I'm starting with this because this is one of the major medications that people keep taking every now and then. A lot of people know this particular one, tetracycline. And most people take it when they are having diarrhea cases. When you are having watery stool, most people take this particular medication, but it is an antibacterial medication that is meant to cure bacterial infections, not diarrhea. If the diarrhea is not caused by bacteria, then you taking tetracycline, you're wasting your time, because there are other things that can cause diarrhea. So when you take this medication as a woman who is planning to get pregnant, or as a woman who is pregnant, let's start with the women who are planning to get pregnant. This medication stays in your system for 3 good months. It stays in your system for 3 good months. So within these first 3 months, if you take this medication and you get pregnant within these 3 months, this medication can get into your baby's system and affect your baby's system. One of the major things that this medication causes your baby is tooth discoloration, which means it can change your baby's tooth color, causing the tooth to be fragile, have an unpleasant look. And that's why you must avoid this medication as a woman who is planning to get pregnant, or as a woman who is pregnant, because children are not meant to take this medication. And once you take it when you are pregnant, it can cross into your baby's system and start affecting your baby. Now, the second thing that this medication can do is it can affect your baby's heart, it can affect your baby's brain, it can affect your baby's kidney. And that's why you must avoid this medication by all means. And not just that, you as a woman, it can also affect your system when you are pregnant. So you must avoid tetracycline if you are planning to get pregnant as a woman, or if you are pregnant as a woman. The second medication is called piroxicam. Piroxicam is a non-steroidal anti-inflammatory medication which is meant to relieve you from pains, inflammation, and what have you. Most people take this medication when they are having menstrual crisis, when they are having menstrual cramps, when they are having pains, inflammations. But this medication can cause problem to your fertility, and it can also cause problem to your baby that is in your womb if you are pregnant. It can also cause problem to you, the pregnant woman. It can endanger your life. And that's why you must avoid this medication, this particular piroxicam, when you are pregnant. Now, let me tell you one of the major things that this medication does to women when they are planning to get pregnant. It can delay your fertility, or it can even reduce your chances of having a successful, ovulation as a woman. So you must avoid this medication, this piroxicam, if you are planning to get pregnant. The other thing that this medication can do is it can make you undergo miscarriage if you are pregnant, because this medication closes the channel to baby's heart too early. The channel to your baby's heart when your baby is growing is supposed to stay for a certain period of time before it closes, because there is a connection between you, the mother, and the baby. So when you take this medication, it can cause a blockage within this channel from your baby's heart to your own heart as a woman. And that's why you must avoid this medication, because this medication is meant to treat inflammation, and once you take it, it will start making tissue to grow within your baby's heart, and it will cause a blockage, thereby making you to undergo miscarriage. It can make you even deliver your baby when your baby is still 5 months, 6 months, 7 months. That's why you must avoid this medication. Not just that, this medication can put you at a risk of bleeding as a woman. When you deliver your baby, you might bleed so much as a woman when you deliver your baby. And that's why you must avoid piroxicam if you are planning to get pregnant, or if you are pregnant as a woman. So you can see that these medications are not just harmful to you as a woman who is planning to get pregnant, or as a woman who is pregnant, but also harmful to the baby who is in your womb, the innocent baby who is in your womb. So if you find this video very helpful, please do well to subscribe to my YouTube channel. Also share this video to as many people as you can. You may be saving the life of someone. And don't forget to drop your questions on the comment section so I can respond to them as soon as possible. Thank you for watching this video. I'll see you next time.